This is All India Radio. We now bring you a special news program on COVID-19. Good evening. I'm Tanvi Taneja and with me is R.S. Raghu. The headlines. Doubling rate of COVID-19 cases slows down from 3.4 days to 7.5 days after lockdown, says Health Ministry. Goa becomes COVID-free. No new positive case reported in 59 districts of 23 states. Centre asks states and union territories for strict compliance of lockdown guidelines. Government allows certain relaxations from today in notified services in areas without hotspots. No relaxation in containment areas. 36% increase in sown area of summer crops, says Agriculture Ministry. Railways distributes over 20 lakh cooked meals free to needy people during the lockdown period. And Road Transport and Highways Ministry launches a dashboard on its website to facilitate truck and cargo drivers and cleaners. (1,553) fresh confirmed cases of COVID-19 have been reported in the country in the last 24 hours, taking the total number to 17,265. Out of these, 2,546 patients have recovered and have been discharged from the hospitals. Briefing media in New Delhi today, Health Ministry officials said that India's doubling rate of COVID-19 cases before lockdown period was 3.4 days and now it has slowed down to 7.5 days.
इंडिया का डबलिंग रेट लॉकडाउन से पहले जो 3.4 था अब वह इम्प्रूव होकर 7.5 हो चुका है और इससे संबंधित और भी एक अच्छी न्यूज ये है कि अगर हम 19 अप्रैल तक का डेटा लें तो इस नेशनल एवरेज के तहत 18 स्टेट्स में नेशनल एवरेज से बेटर परफॉर्मेंस और बेटर इम्प्रूवमेंट नोटिस किया गया है.
As per data on 19th of April, in 18 states the rate is better than the national average. The official informed that Mahe in Puducherry, Kodagu in Karnataka and Pauri Garhwal in Uttarakhand have not reported any COVID-19 case in the last 28 days. He said the number of districts where no case has been reported in the last 14 days has increased to 59 districts of 23 states. He said the doubling rate of COVID-19 cases is more than 30 days in Odisha and Kerala and there is no active case in Goa now. The official added that the doubling rate of infections in India has slowed down. Home Ministry officials said that the ministry is regularly monitoring enforcement of lockdown measures. She said where violations of lockdown are occurring, suitable measures are being taken in discussion with the states. She said Home Ministry has also written a letter to states stating that guidelines made under the Disaster Management Act specify that states are required to strictly follow these guidelines. The official said that the ministry also wrote to Kerala government expressing concerns over modified guidelines regarding lockdown issued by the state. She said Kerala has allowed some activities that violate the centre's instructions issued under the Disaster Management Act. She also said that central government has constituted 6 interministerial teams to make assessment of COVID-19 situation and augment state efforts to fight and contain the spread of COVID-19 effectively. She said the purpose of constituting the teams is to assist and support the states in containing the spread of coronavirus. She informed that the situation is particularly serious in Indore in Madhya Pradesh, Mumbai and Pune of Maharashtra, Jaipur of Rajasthan and Kolkata, Havda, Mednipur East, 24 Parganas North, Darjeeling, Kalimpong and Jalpaiguri of West Bengal. She said the central government has constituted 6 interministerial teams to assess COVID-19 situation and augment state efforts to fight and contain the virus spread effectively. She said the team has reached the assigned destinations.
कुछ जिलों में कोविड-19 के संक्रमण की स्थिति गंभीर है या गंभीर होती जा रही है, जैसे राजस्थान में जयपुर, मध्य प्रदेश में इंदौर, महाराष्ट्र में मुंबई और पुणे, पश्चिम बंगाल में कोलकाता, हावड़ा, 24 परगना नॉर्थ, मेदिनीपुर ईस्ट, दार्जिलिंग, जलपाईगुड़ी और कालिम्पोंग। इन चारों राज्यों के प्रभावित जिलों का ऑन द स्पॉट आंकलन करने के लिए गृह मंत्रालय ने 6 इंटर मिनिस्टीरियल सेंट्रल टीमों का गठन किया है। ये टीमें अपने निर्धारित स्थान पर पहुंच चुकी हैं।
Agriculture Ministry representative said that sown area of summer crops has registered 36% increase over last year, pushed mainly by rice cultivation. She said farming has been exempted from lockdown, but social distancing has to be maintained. ICMR officials said that rapid antibody test is not used for individual diagnosis, as we do not know how powerful the antibody developed will be against the coronavirus. He said it can be used for surveillance, and consistent errors will not affect assessment of infection trends in epidemiological surveys. On complaint regarding repeat testing of some patients in West Bengal, the official said that RT-PCR testing kits need to be kept below 20 degrees Celsius, and if temperature is higher, then proper test results are not obtained. Union Home Ministry has urged states and union territories to ensure strict compliance and implementation of revised consolidated guidelines on lockdown measures without any dilution to fight COVID-19. In a letter to states, the ministry observed that certain states are allowing activities not permitted under Home Ministry guidelines. Home Ministry spokesperson said violations to lockdown measures have been reported, which pose a serious health hazard to public and risk for spread of COVID-19. There have been incidents of violence on frontline healthcare professionals, complete violations of social distancing norms, and movement of vehicles in urban areas. The situation is especially serious in Indore in Madhya Pradesh, Mumbai and Pune in Maharashtra, Jaipur in Rajasthan, Kolkata, Howrah, Mednipur East, 24 Parganas North, Darjeeling, Kalimpong and Jalpaiguri in West Bengal. The union government has constituted 6 interministerial central teams to make on-spot assessment of COVID-19 situation, issue necessary directions to state authorities for its redressal, and submit their report to the centre. The teams will focus on compliance and implementation of lockdown measures as per guidelines, supply of essential commodities, social distancing, preparedness of the health infrastructure, safety of health professionals, and conditions of relief camps for labour and poor people. Kerala has amended certain relaxations declared earlier after Union Home Ministry expressed strong objection, saying that it violates Centre's consolidated revised lockdown guidelines issued on April 15th. A report.
After the high-level meeting headed by Chief Minister Pinarayi Vijayan in Thiruvananthapuram today, Kerala decides to amend few relaxations announced earlier. Accordingly, barber shops will not open till further notice, dine-in restaurants will not be allowed, only parcel services will be allowed, pillion riding will not be allowed in two-wheelers. The decision was made after the centre pointed out that certain relaxations declared by Kerala government earlier dilutes the guidelines issued by Ministry of Home Affairs and violates the MHA order dated April 15th on lockdown measures. Chief Minister Pinarayi Vijayan said that the state had always worked in coordination with the centre and will seek centre's permission for special relaxations in the future too. Meanwhile, 6 more positive COVID-19 cases were confirmed today, whereas 21 persons recovered from the disease. Mayusha for AR News from Thiruvananthapuram.
Union government has allowed certain relaxations from today in the notified services in areas without hotspots. In the wake of extension of national lockdown till 3rd May, a series of directives have been put in place to ensure a strict compliance of lockdown. However, keeping in mind the current financial situation of low-income earners and farmers, the centre has said that it will be permitting a few more services to function in areas that are not COVID-19 containment zones from today. Operation of the fishing aquaculture industry, movement of fish and fish products and workers of all these activities are allowed. The guideline also allows operations of tea, coffee and rubber plantations with maximum of 50% workers. Poultry farms, livestock farming activity are allowed. Food processing industries in rural areas, manufacture of IT hardware, coal production, mines and mineral production, manufacturing units of packaging material have been allowed to operate. Operations of seaports and inland container depots for cargo transport, including authorized custom clearing and forwarding agents, will function as well. IT and IT-enabled services have been allowed to resume functioning with up to 50% strength. More from our correspondent.
These limited exemptions will be operationalized by states, union territories, district administrations based on strict compliance to the existing guidelines. All agricultural and horticultural activities, including farming operation by farmers and farm workers in field, agencies engaged in procurement of agricultural products, including MSP operations, mandis operated by Agriculture Produce Market Committee, shops of agriculture machinery will remain fully functional during the time. In addition, all finance-related institutions and health-related service will remain fully functional. Industries operating in rural areas and outside the limits of municipal corporation and municipalities, and manufacturing and other industrial establishment with access control in special economic zones and export-oriented units, industrial estates and industrial townships will be allowed to function. Anupam Mish, AR News, Delhi.
An amount of 17,793 crore rupees has been released to 8.89 crore farmers under the Pradhan Mantri Kisan Samman Nidhi PM Kisan scheme so far during the lockdown period. Ministry of Agriculture in a statement said, in order to provide food security during the prevailing situation due to COVID-19 pandemic, the government has decided to distribute pulses to the eligible households under Pradhan Mantri Garib Kalyan Yojana PMGKY. It said over 1.07 lakh metric tons pulses have so far been issued to the states and union territories. It said the distribution of pulses under PMGKY is to benefit around 19.50 crore households spread across 36 states and union territories. Railways has distributed over 20 lakh cooked meals free to needy people during the lockdown period in light of COVID-19. Our correspondent reports that more than 11 lakhs of these cooked meals have been provided by IRCTC.
Railways has been providing bulk cooked food with paper plates for lunch and food packets for dinner through IRCTC-based kitchens, RPF resources and contribution of NGOs. Starting with distribution of food to around 5,000 needy persons at over 74 locations on 28th of last month, the number has grown every day. Presently, about 50,000 people are provided meals daily at around 300 locations across the country. Proper social distancing is being ensured during preparation and distribution of meals. The Railway Protection Force has played a major role in food distribution to needy people prepared by IRCTC, NGOs and from its own kitchens. With Dipendra, Anand Kumar, AIR News, Delhi.
Vaibhav Bhatt, an auto rickshaw driver from Panchmahal district, thanks government for providing free ration during the tough times of the lockdown.
मेरा नाम भरत कुमार भट्ट है। मैं वैभव सोसाइटी में रहता हूँ और मैं ऑटो रिक्शा चलाता हूँ और मुझे सरकार से की तरफ से पीएल कार्ड 1 की किट मिली है, उससे मैं थोड़ा गुजारा चलता है और वो किट देने से मेरा सरकार का आभार मानता हूँ।
In our series Expert Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, Director AIMS Dr. Randeep Guleria advised the people to aggressively follow the social distancing and hand hygiene norms to check the spread of COVID-19 infection.
सोशल डिस्टेंसिंग, हैंड वॉशिंग भी हम पूरी तरह से करें। हम एक ये नियम बना लें कि अब से आगे से चाहे वो थूकना हुआ, चाहे वो सोशल डिस्टेंसिंग हो, चाहे जब भी घर आए तो हाथ धोएं, जब भी किसी से मिले तो हाथ जोड़ के मिलें और हैंड वॉशिंग रेगुलरली करें। इससे कोविड ही नहीं, कई और इन्फेक्शन जैसे स्वाइन फ्लू है या टीबी है, ये भी हमारे देश में कम होंगी।
Talking to AIR News, Dr. Naresh Gupta of LNJP Hospital, Delhi said that in most of the cases, the COVID-19 infections are self-limiting and very few patients required admission in hospital.
Social distancing is very useful, and I also must remind that social distancing, which actually, as I said, is physical distancing, would save you not only from coronavirus, but also save you from dozens of other viruses that cause cold and many other diseases. You yourself said about the common cold. Now, all those common colds also tend to spread through the respiratory system, so they'll also be prevented.
Indian cricketers have urged people to wear masks and take all necessary precautions against COVID-19. Sachin Tendulkar, Virat Kohli, Saurav Ganguly, Rohit Sharma, Harbhajan Singh and others appeal to people to wear homemade masks and become a part of Team Mask Force in the fight against COVID-19.
आप अपनी पूरी फैमिली के साथ हमें चेयर करते हैं और आज मैं आपकी पूरी फैमिली से ही बात करने आया हूँ। टीम इंडिया का हिस्सा होना एक बहुत गर्व की बात है। आज एक उससे भी बड़ी टीम बनने जा रही है, टीम मास्क फोर्स।
जैसे हमारे प्रधानमंत्री ने कोरोना वायरस से लड़ने के लिए तरह तरह के टास्क फोर्स बनाए हैं, उसी तरह हम 130 करोड़ हिंदुस्तानियों को भी अपने घरों में कोरोना वायरस के खिलाफ बनानी है एक मास्क फोर्स।
मास्क फोर्स का हिस्सा बनना बहुत ही आसान है। बस घर बैठे बैठे अपने लिए एक मास्क बनाइए।
ये किसी भी साफ कॉटन के कपड़े से बनाया जा सकता है।
कम ऑन इंडिया, मास्क बनाओ और मास्क फोर्स का हिस्सा बन जाओ। और हाँ, याद रहे, साथ ही 20 सेकंड तक हाथ भी धोने हैं और सामाजिक दूरी भी बनाए रखनी है।
मास्क घर बैठे आसानी से कैसे बनाना है, इसकी सारी जानकारी आपको आरोग्य सेतु ऐप पर मिल जाएगी। आज ही डाउनलोड कर लीजिए।
The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion on COVID-19. Dr. Mala Srivastav, Senior Consultant, Sir Gangaram Hospital will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1800-115767. The number is 1800-115767. You can also ask questions on telephone number 011-2331-4444. The number is 011-2331-4444. And post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:25 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates. This is All India Radio bringing you a special program on COVID-19. A reminder of the headlines before we move on. Doubling rate of COVID-19 cases slows down from 3.4 days to 7.5 days after lockdown, says Health Ministry. Goa becomes COVID-free. No new positive case reported in 59 districts of 23 states. Centre asks states and union territories for strict compliance of lockdown guidelines. Government allows certain relaxations from today in notified services in areas without hotspots. No relaxation in containment areas. 36% increase in sown area of summer crops, says Agriculture Ministry. Railways distributes over 20 lakh cooked meals free to needy people during lockdown period. And Road Transport and Highways Ministry launches a dashboard on its website to facilitate truck and cargo drivers and cleaners. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
The Drugs Controller General of India, DCGI, has approved trial of a drug for reducing mortality rate in critically ill COVID-19 patients. The trial is likely to begin at multiple hospitals. The drug, which has been developed by Cadila Pharmaceuticals Limited with the support of Council of Scientific and Industrial Research, CSIR, is meant to treat critically ill patients suffering from gram-negative bacterial sepsis. CSIR appointed monitoring committee supervised the research trials and development of this drug, which has proved its efficacy in providing faster recovery from organ dysfunction seen in infected patients. The drug has been found to be extremely safe in patients and no systemic side effects are associated with its use. It can be used concurrently with any other therapeutic treatments. Road Transport and Highways Ministry has launched a dashboard on its website to provide details of dhabas and trucks. The list can be accessed at www.morth.nic.in. The ministry said this is intended to facilitate travel of truck and cargo drivers and cleaners. A regular contact is being maintained with various stakeholders providing information. National Highway Authority of India's centralized call number 1033 has also been activated to answer calls and provide information about the dhabas and repair shops along the national highways. The ministry said people have to follow all necessary precautions and healthcare protocols of social distancing at these spots and use masks. Prime Minister Narendra Modi has said India and Afghanistan share a special friendship based on ties of history, geography and culture. Responding to Afghanistan President Ashraf Ghani, who thanked India for providing medical and other support, Mr. Modi said, for long the two countries have fought jointly against the scourge of terrorism, and they will similarly combat COVID-19 together with solidarity and shared resolve. Earlier, Afghanistan President thanked Prime Minister Modi for providing hydroxychloroquine and paracetamol tablets and 75,000 metric tons of wheat.
Uttar Pradesh Chief Minister Yogi Adityanath has decided not to take part in the cremation of his father due to lockdown restrictions. The Chief Minister's father, Anand Singh Bisht, passed away this morning after a critical illness. Yogi Adityanath said that his father played a great role in his life. The Chief Minister expressed his grief at the irreparable loss but said that due to lockdown he will not take part in the last rites of his father and could only visit his home after the lockdown is lifted. He also asked his family to involve minimum persons in cremation ceremony. In Uttar Pradesh, complete lockdown continued in the districts where 10 or more cases of coronavirus have been detected. Construction work and other economic activities have started in a limited manner in some districts with strict social distancing norms and precautionary measures. A report.
Guidelines of Health Department are being strictly followed at the industrial units where relaxation in lockdown was permitted by district administration. Construction work on Purvanchal and Bundelkhand expressways also started today. The state government has ordered to keep those students in quarantine after screening who had returned from Kota, Rajasthan recently. Additional Chief Secretary Home Avnish Awasthi said that more than 10,000 such students will be allowed to go to their homes only after downloading the Arogya Setu app. The state government has also ordered for testing of those persons who are involved in doorstep home delivery. The state is testing more than 2,000 samples of suspected patients daily. Sushil Chandra Tiwari, AIR News, Lucknow.
Assam Chief Minister Sarbananda Sonowal has reposed faith on the people of the state that they would strictly follow the second phase of lockdown as well. Speaking to All India Radio News, the Chief Minister expressed gratitude to the people for properly responding to the Prime Minister's call of lockdown. Mr. Sonowal appealed people to perform all religious activities at home instead of going outside. He urged people to follow social distancing.
In Maharashtra, as many as 283 new COVID-19 positive cases were recorded today. With this, the total number of COVID-19 affected patients has reached 4,483. Mumbai alone has around 2,911 cases. According to Mumbai civic body, at least 53 media persons in the city have tested positive for coronavirus. Meanwhile, 2 workers from the civic body's disaster management cell have been tested COVID-19 positive. Details from our Mumbai correspondent.
Addressing the people, Chief Minister Uddhav Thackeray said relaxation of norms should not be seen as indication that the threat of virus has receded in any way. He reiterated that people should maintain discipline and practice social distancing to curb the spread of virus. Meanwhile, the Nagpur bench of the Bombay High Court has sought the Maharashtra government's response to a plea challenging its circular prohibiting door-to-door distribution of newspapers in view of the coronavirus pandemic. The government order stated that while newspapers can be sold at stalls, door-to-door distribution by vendors cannot be permitted at this stage looking at the rapid spread of coronavirus. Kunal Shinde, AIR News, Mumbai.
In Tamil Nadu, 43 new COVID-19 cases have been confirmed today, taking the total to 1,520, while 46 others were discharged. The State Health Minister, Dr. C. Vijaya Bhaskar, told reporters in Chennai this evening that 2 people died of the disease in the last 24 hours, raising the total loss of lives to 17. More from our correspondent.
The number of new cases in Tamil Nadu has come yet again under 50 today after a spike to 105 yesterday. As the state remains one of those with the maximum caseload, the government has decided to extend the lockdown till May 3rd. In a statement issued in Chennai, the administration has said the decision has been taken based on the report of the expert committee on the lockdown and also in tune with the centre's announcement. It has made it clear that any decision on relaxing the lockdown conditions later would be based on studying the ground situation further. Jai Singh, AIR News, Chennai.
The Karnataka Cabinet has decided to promulgate an ordinance that gives the government special powers to provide protection to the frontline health workers. The decision comes after a mob turned violent in Padrayanapura yesterday when health workers were trying to shift suspected COVID-19 persons to the quarantine facility. In the Union Territory of Jammu and Kashmir, advisor to Lieutenant Governor Rajiv Rai Bhatnagar took a detailed review in Srinagar about the health department activities regarding prevention and control of coronavirus. He directed health officials to increase the testing capacity so that the virus can be contained. Our Srinagar correspondent has more.
Jammu and Kashmir administration is tirelessly reaching out to the people of Jammu and Kashmir to mitigate their sufferings in the wake of coronavirus pandemic. Advisor to Lieutenant Governor Rajiv Rai Bhatnagar convened a meeting at Srinagar today and reviewed the overall health sector scenario, Kashmir division. He instructed the officials to ensure that frontline workers be provided with PPE kits and adequate quantities of these kits, medical supplies and other equipment made available in all the hospitals to deal with the situation. This is Sunil Kohl for AR News from Srinagar.
In an effort to guard against fake news being circulated on various platforms, we bring you a new segment on fact-checking and mythbusters. A rumor is being circulated on various platforms that persons with A-positive blood group are more vulnerable to COVID-19 infection. In conversation with All India Radio, Dr. Mohsin Wali, Senior Consultant at Dr. Ram Manohar Lohia Hospital, and Dr. Madhur Yadav, Professor of Medicine at Lady Hardinge Medical College, New Delhi, said that there was no evidence for this. They said that no particular blood group is at greater risk of the virus infection. Government has come across reports in a section of media that elephants in Chilla Range, Uttarakhand, are contracting COVID-19. This is fake news. We checked the facts with ranger of Chilla Range at Rajaji National Park, Anil Panivali in Dehradun. He has categorically stated that such reports are false and baseless.
कुछ टीवी चैनल पर चिला रेंज में हाथियों को कोरोना संक्रमण के बारे में खबर चल रही है। ये खबर बिल्कुल ही निराधार, बेबुनियाद और भ्रामक है। ऐसा कोई केस नहीं है। चिला रेंज बिल्कुल सुरक्षित है। हम न केवल हमारे पालतू जानवर बल्कि हमारा पूरा स्टाफ और जंगली जानवर हमारे पूरी तरह से कोरोना से मुक्त हैं।
Citizens are requested to be aware of such misleading information and stay clear of such rumors. The government today dismissed a report by a media portal which has claimed that children in Jahanabad district in Bihar are eating frogs as they have no food at home. In a tweet, the Press Information Bureau has termed the report as false. It said that the Jahanabad district magistrate has stated that there is sufficient food in the homes of the children.
In Odisha, Chief Minister Naveen Patnaik dedicated 5 standalone COVID hospitals through video conferencing today. These hospitals will provide specialized treatment to COVID-19 patients. Our correspondent filed this report.
Chief Minister Naveen Patnaik inaugurated 5 COVID-19 hospitals in the district of Sundargarh, Bargarh, Anugul, Jagatsinghpur and Navrangpur with a combined capacity of 825 beds. With this, the state's dedicated COVID-19 hospitals are now functional in 26 districts with a total bed capacity of 5,000. Union Steel, Petroleum and Natural Gas Minister Dharmendra Pradhan, Union Minister Prahlad Joshi and Odisha Health Minister Nava Das also joined the program through video conference. Meanwhile, the state has reported 74 positive cases for COVID-19 out of the 10,641 samples tested so far. Itish Singh Rathore, AI News, Cuttack.
In Mizoram, many government-sponsored programs are giving relief to the poor people to minimize the economic impact due to the lockdown imposed countrywide to contain the spread of COVID-19. With the Manrega works coming into force in this period, many people in rural areas are getting jobs on their demand and they have started, and wages in their bank accounts have also started. The state government has also increased the Manrega wage to 225 rupees per day per person. And now, before we end, the headlines once again. Doubling rate of COVID-19 cases slows down from 3.4 days to 7.5 days after lockdown, says Health Ministry. Goa becomes COVID-free. No new positive case reported in 59 districts of 23 states. Centre asks states and union territories for strict compliance of lockdown guidelines. Government allows certain relaxations from today in notified services in areas without hotspots. No relaxation in containment areas. 36% increase in sown area of summer crops, says Agriculture Ministry. Railways distributes over 20 lakh cooked meals free to needy people during lockdown period. And Road Transport and Highways Ministry launches a dashboard on its website to facilitate truck and cargo drivers and cleaners. And with that, we end the special news program on COVID-19.